So you're a certified clinical sexologist, a professional sex coach, and also a certified sex therapist. What is the difference between the three, a
Yes, great
therapist, a
question.
coach, and a
And it's a
sexologist?
lot of different training, but they all really have a different approach. So sexology really comes from the scientific background of why we do things sexually and how. So looking at behaviors and the understanding of our sexual behavior. So I use a lot of my sexological training for education to help people have good resources and tools. So there's a lot of education I use with sexological approaches, from everything from how to assess, with how to help clients understand, self-examination of their bodies and understanding physiological and biological things that we do sexually that are really our kind of primal instincts. And then sex coaching kind of works with that and offers a more solution focused approach to working with sexual concerns. Because many clients come in, they're very high functioning, they may not have mental health issues, and they're just really looking for tips and tools. I want some books to read, or I want to know about products, or I'm curious about vibrators, but I'm not really sure. Where do I start? So I find sex coaching to be a great alternative to therapy because we really start with the current. What's going on now? What can we do to provide some good resources and get you excited about sex? That could be going on a field trip to a store where you're buying some products or actually doing demonstrations. What I love about sex coaching is I have a lot of tools. I have devices I'll bring out, I have vulva puppets and things that I'll use to help people understand concepts in sexuality. And then therapy is the type of approach where we're doing talk therapy, we're processing, but we're really looking at all aspects of that person, their identity, their values, their culture, their early life. And this is where my psychodynamic work comes in. I want to know about early relationships, traumas, things that have gone on that really shaped who that person is sexually. And it helps me understand a bit more about their ways of thinking and things that actually maybe where they're stuck in their life. So very different. I always tell people not everyone needs therapy when it comes to sexual issues. And that's why, assessing and really looking at what the concern is and giving someone a space to be able to address some of these issues may, determine which one of those approaches or modalities works best. And to be honest, I kind of use a combination of those when I work with clients. We'll do a little bit of therapy and coaching and in most of my cases working with sexual issues.